Happy New Year, guys. I hope you had a lovely festive break and I'm sure a well-deserved rest. In this first video of the new year, I wanted to address some questions I always get asked on my face-to-face courses in relation to CPR.
Now, the first question that I always get asked is, do I have to put my mouth on theirs? Because they're normally concerned about infection, and rightly so, especially in the current climate. So the answer is yes and no. It all really depends on the casualty you've got in front of you. So if you're working with adults, the guidelines since 2015 have stated if you're unable and unwilling to give rescue breaths, then please do something. And that something will be compressions and compressions only. If you don't want to put your mouth on a complete stranger, if you haven't got a barrier such as a face shield or pocket mask in order to prevent infection from you to them and them to you, then just do something, because something is better than staring at them. If you stare at a casualty, they are not going to come back to life. You attempting to do compressions is better than doing nothing at all. Now, with a child or someone under 18 or a drowning casualty, those 5 initial rescue breaths are really important. Remember what we said in the video previously, that a child and a drowning casualty, the reason the heart has stopped is not a problem with the heart, is because it's a problem with oxygen, and they need the oxygen. So it's quite important that we give them oxygen. So make sure we do have a face shield or a pocket mask or some type of barrier between you and them to prevent infection, and attempt to give up to 5 rescue breaths, and then 30 compression and 2 rescue breaths. So for a child and a drowning casualty, so anyone under 18 and anyone that's suspected to be drowning, rescue breaths are very, very important. Next question I get asked is, what happens if the casualty is sick? Well, if the casualty is sick, we just need to turn them over on their side, make sure they're not choking on their vomit, wait for them to finish being sick, roll them back again, check to see if they're breathing, because if they are breathing, great, but if they're not, we need to carry on with CPR. And of course, I would encourage you to use a face shield as well. Now, another question would be, my rescue breaths are not working. I don't see the chest rise and falling. Now, remember we said we need to see a gentle rise and fall of the chest, but you've got to make sure you open the airway. So if you don't see that gentle rise and fall of the chest, maybe the airway is not open. Maybe you haven't got a good seal. So make sure you fully open the airway. It should be fully extended here at the neck. Make sure you're pinching their nose, or you're covering their nose, depending on what casualty you've got in front of you. And make sure you've got a good seal around their mouth. Now, if it still doesn't work, there might be another reason. They might have a blockage that's out of your control. But make sure you've opened the airway and make sure you've got a good seal. And we're only going to attempt 5 initial for a child or a drowning casualty. Then after that, we're only attempting 2. Then I always get asked, how do I know I'm going deep enough? I don't want to hurt them. Well, listen, this casualty is not breathing. You've got to do something to them. And my advice to you would be, go hard. Because if you don't go hard enough, all you are doing is tickling them. But a good tip to see if you are actually being effective with your compressions would be colour. You should hopefully see the colour coming back to their face if you're going deep enough with a compression. Because at the end of the day, you're pumping the heart, which is pumping blood around the body, which has got oxygen in there, so you should see colour coming back up to their face. And it doesn't matter what colour skin someone's got. We've all got nice red rosy lips. So you should see colour coming back to their lips and back to their face as well. And then finally, the question I get asked is, I'm tired. When can I stop? Of course, you can stop CPR if your life is being affected. For example, preserve life. It's your life as well. Even if you just have a little rest, I'd probably, if I had to stop, run out of my workplace, my home, wherever I am, and scream for someone else to come and help me so they can take over. And if there's a helper there, they should be taking it in turns with me. One person does something, the other person rests, and keep going like that. But you would stop if you're by yourself, if you can't carry on anymore. If the casualty comes back to life, please do stop then. If the ambulance turn up, or someone else, of course, takes over from you, then you would stop them. Don't forget to hit that subscribe button so you don't miss out on any of our important videos.